Common myths and facts of mental illness. Myth number 1. There's no hope for people with mental illnesses. Fact. There are more treatments, strategies, and community supports than ever before. And even more are on the horizon. People with mental illnesses can lead active, productive lives. Myth number 2. People with mental illnesses are violent and unpredictable. Fact. In reality, the vast majority of people who have mental health needs are no more violent than anyone else. People with mental illness are more likely to be victims of violence. You probably know someone with a mental illness and don't even realize it. Myth number 3. Mental illnesses are brought on by a weakness of character. Fact. Mental illnesses are a product of the interaction of biological, psychological, and social factors. Research has shown genetic and biological factors are associated with schizophrenia, depression, and alcoholism. Social influences, such as the loss of a loved one or a job, can also contribute to the development of various disorders. Myth number 4. Mental illnesses cannot affect me. Fact. Mental illnesses are surprisingly common. They affect almost every family in America. Mental illnesses do not discriminate. They can affect anyone. 1 in 5 American adults have experienced a mental health issue. 1 in 10 young people experienced a period of major depression. 1 in 20 Americans lived with a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. Myth number 5. Children don't develop mental illness. Fact. Millions of children are affected by depression, anxiety, and other mental illnesses. 1 in 10 children lives with a diagnosable mental illness. Getting treatment is essential. Half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before age 24. Unfortunately, less than 20% of children and adolescents with diagnosable mental health problems receive the treatment they need. Early mental health support can help a child before problems interfere with other developmental needs. Myth number 6. People with mental health needs, even those who have received effective treatment and have recovered, cannot hold jobs and be productive workers. Fact. Employers who have hired people with mental illnesses report good attendance and punctuality, as well as motivation, quality of work, and job tenure on par with or greater than other employees. Myth number 7. Once people develop mental illnesses, they will never recover. Fact. Studies show that most people with mental illnesses get better, and many recover completely. Recovery refers to the process in which people are able to live, work, learn, and participate fully in their communities. For some individuals, recovery is the ability to live a fulfilling and productive life. For others, recovery implies the reduction or complete remission of symptoms. Science has shown that having hope plays an integral role in an individual's recovery. You can make the difference. Remember, one of the best ways you can help people living with mental illness is by understanding what it is and what it isn't. Myths about mental illnesses contribute to stigma, which in turn prevents people living with mental illness from seeking help. Finally, mental illnesses are treatable, allowing those who live with them the opportunity to lead full and productive lives.